Hello, my name is Dr. Carlos Wolf, and today I'm going to talk about Dysport and Restylane. Dysport is a new botulism A toxin, which is an alternative to Botox. Dysport became approved and in use in the United States approximately June 2009. We have been using it since its approval in many patients with very successful results. Dysport is injected very much like Botox in the same areas. The patient is injected along the area of the wrinkles, up on the forehead and around the crow's feet. It can be used in the neck for removal of wrinkles and cords of the platysmal bands. And the results are seen usually within 1 to 2 days and will peak about 10 days later. The results can last from 3 to 4 months and in some cases much longer. It's a procedure that is done very easily and the patient can resume normal activity the following day. Restylane is a hyaluronic acid which is used primarily for filling in depressions in and around the nasolabial fold, marionette lines. You can augment the lips, make them look a little bigger. You don't want to make them look artificially large, but just improving the quality and the look of the lip. This can be done in young women as well as older women who have lost volume and have many wrinkles around the lips. The Restylane can also be used in the cheek area, along the jowl area, to mask little depressions so that the jowl looks nice and straight and it doesn't look like it's falling. And now that I've told you what Dysport and Restylane are, let's go treat a patient. So what we're going to do now is we're going to start the treatment of Restylane. But before we do Restylane, we generally give some numbing medication that helps with the patient. So what we're going to do is this is just some numbing medicine we're going to put on both sides here. And we just rub it in a little bit. And we let that sit about 10-15 minutes. This works really well. And so we're going to put some cream like this on. And now we'll let her sit for about 15 minutes and then we'll return to inject her with the Restylane. In the interim, what we can do is we're going to set her down and we're going to inject the Dysport. What I'm going to do now is I'm going to draw up the Dysport. It comes in a bottle which we dilute with fluid, and here we are. We're going to bring in approximately 1 cc. This needle, of course, is not what we're going to be using for the patient because it is a very big needle, and we want to make it as small as possible with the least amount of discomfort. So now we're going to take a very small needle and get it ready, and we're all set for the injection. So now what we're going to do is we're going to first clear the area out with a little alcohol so that we prevent any kind of potential infection. And we've already drawn up the Dysport. So what we're going to do is now we're going to inject her. And I ask my patients to move up and down, elevate your brows, and wrinkle here. So what we're going to be doing is we're going to be injecting this area and around the eyes. Now she's going to get a little elevation of her brows. In order to prevent her from getting too much elevation, I'm going to inject her a little bit here and here so that it will make her Dysport look very natural as opposed to that really unnatural look that you see on TV a lot. So here we are, we're going to start injecting. And she's very good, she's a great patient. And these little bumps that you see here, they'll disappear in about an hour or two. Now we're just going to do a little bit right here. That's just going to quiet down the movement of the muscle. That way she'll look really natural. She'll get a nice elevation, but not too much. Now we're going to inject the side here, which is for her crow's feet. And this also helps in creating a little more elevation as the muscle that pulls this down is released and it elevates it from there. So what I'm going to do now is I'm going to inject with Restylane. And Restylane is a hyaluronic acid. And what it is, it comes in, if you're ever going to have Restylane, you should make sure they're taking it out of a box. Otherwise, it may not be the real thing. Anyway, we're taking out the Restylane. It comes with 2 syringes. It actually comes with 1 syringe and 2 needles. Put the needle on, and we're going to get started with the injection. Okay. And we had some cream on that was for anesthesia, so now we're going to take that off. Now, one of the more sensitive areas when you do this is in the lips, so I always do that last. That way, you'll have a little discomfort, but not too much. Okay. So in your case, what we're doing is you don't like the nasolabial folds here. Mm-hmm. So now we're just going to put it in here. It is uncomfortable. And see, this is instant, so you'll see the results instantly. And you can actually already see in her situation how it's nice filled here as compared to the other side here. Yeah, see, that looks great. That really looks nice. So I'm going to go to the other side now. She's being a great patient. This does have definitely some discomfort. Now these areas right here and here, they're very superficial, so sometimes you can make them a little better, but I don't get too crazy with those because sometimes if you do that, they tend to actually make that area a little more noticeable. So all I did is put a little bit to get rid of that. And here. It almost looks like you had a little bit of a scar there. Open up a little bit. Yeah, I do have a scar there. Yeah, open up a little bit. So scars don't lend themselves well to elevation because if you do that, you can sometimes make it worse. Now what I'm going to do is show you briefly so you can see how it looks.
Oh, wow.
See,
yeah.
so it really fills in nicely here and here. Now, because we have enough, I'm going to give you a little bit on the lip area, which I think you really like. Slow down. And all I'm doing here is augmenting the center part of the lip, which really, if you just look, you know, it's not too bad, but you can see the difference with the right versus the left.
Oh yeah.
So it's a very subtle, but very nice look. You know, when someone has nice shaped lips, this really works very well. Sometimes people have odd shaped lips and you just have to work it a little more, and yours are so nice, so it's so easy to do that. Just have a little bit more here. Yeah, that looks good. Now, take a look here.
Wow. You
get a little bit of where the lip looks like it's coming down the very corner. So all I'm going to do is just put a little bit in here, and that just kind of lifts the lip a little bit. You see? Good, that looks good. Take a look. See, so it's just a now, obviously you just had injections, so you're going to have a little bleeding. What we do is give you a little ice, and sometimes you have a little bruising. So my recommendation when you have Restylane is that if you have a big event coming up, you want to make sure that you give yourself about a week or so for recovery. Because sometimes you get a little bruising. Most people don't, but you know, that's just a good way to go. And that's it. Take a look. I think that looks very nice, huh? And the nasolabial looks beautiful too.
Great.
Not great?
Yeah,
that's a great
really
look.
Good.
What we've done here is we've injected the Dysport in about 15, 20 seconds with minimal discomfort. The Restylane took a little longer, but it's a little more, a little more discomfort, and so that's why we really like to use anesthesia. The whole process has taken about 15 minutes. So you can come into the office, have this done, wait 15 minutes to get your treatment, and really be out in about a half hour. Now we can expect to see the results of the Dysport by tomorrow or the next day, at least some results. It'll peak in about 10 days. And for the Restylane, you see the results right away. And over the next 2-3 days, you'll actually get a little more that will improve. Okay?